This is a 5-year view of worker deaths in construction. There were a total of 83 deaths in the 5-year period, so that is an average of 17 per year. This top chart shows how the number per year was pretty steadily increased from 2018 to 2022. And so the color coding and the abbreviations on the chart correspond to the incident types that are listed in the box to the lower right of the chart, showing the breakdown of 2022 incidents. So those incidents were 8 falls, 6 motor vehicles, 3 struck-bys, 2 accidental poisonings, which were accidental drug overdoses, 2 homicides, 1 electrocution, 1 machinery, 1 fire, and 0 suicides. So if we look at the suicides on this chart, the last fatal incident by suicide was in 2020. So that's, about 2 years since the last suicide, which is amazing. And there's a huge push that everyone's doing in the construction industry to bring awareness to that and training. And, I think that is amazing. And I think it's showing on this chart right here. So if we break down the falls for 2022 incidents, 4 were from roofs, 1 from a ladder, 1 from a scaffold, 1 from a joist, and 1 through a skylight. So the motor vehicles incidents have been increasing, with last year having 6. So that is, increasing quite a bit. But moving on down, in 2022, there were 24 construction workers that died, the most since Washington PACE began counting in 1998. 30% of those workers died due to a fall. 25% of those were the motor vehicle incidents. 3 workers died in a trench collapse struck by incident. 2 of those workers died by accidental poisonings, which I said before was drug overdoses. 2 died by homicide and none by suicide. And then in 2018 to 2022, so that's a 4-year period, the annual construction work deaths more than doubled, from 11 in 2018 to 24 in 2022. Falls and motor vehicle incidents caused the most deaths. 10 workers fell from roofs and 2 fell from communication towers. Among motor vehicle incidents, 50% or 56% of workers were in vehicles and 44% were on foot. Struck by deaths included 2 workers who died in a tower crane collapse. So again, I posted this in the chat for everyone to see. Stop sharing. Does anyone have any questions or comments on the stat?
Cassidy, how about
Yes.
2023?
Oh, that's right. I did pull that for you. So 2023 construction fatalities to date. There were 7 total so far. 3 were falls, 1 electrocution, 1 machinery, 1 motor vehicle, and then 1 accidental poisoning, which is the accidental drug overdose. So we're, heading towards mid-September, and we've had 7. Last year there was 24. So I would venture to say that we are doing a lot better than we were last year. But there's still a ton of room for improvement. We're still seeing a lot of falls. And so I think that's definitely a continued focus that we all need to be doing out there.
Excellent. Thank you for sharing that information, Cassidy.
Yep.
We appreciate those statistics, and appreciate you jumping in and filling in with some of this information today.
Yeah.
Thank you very much. Is there anything
And
from
then
your
just
cohort, Paul?
Oh, yeah. So Paul wasn't able to join today, unfortunately. He will be sharing next month the topics that he had to share. But one last thing I wanted to add is, you all are out in the field and seeing things firsthand. And with the SHARP program, we just want to, produce materials that are useful for you guys. So if there's something that you're seeing out there that you might like a prevention resource on, definitely let me know. I put my email in the chat, and just send me a email, something that you might want to see that would be helpful out there. So I think we had a couple of hands up. Christina.
Hey, Cassie, great job.
Hey.
I just wanted to, I know you're not sharing your screen anymore, but I'm not sure everybody knows that FACE also produces those narratives in a slideshow form, and those have more pictures. I don't know if you want to show them, or I think I sent you the link, but I can certainly put it in the chat, so it gives you a little more visual representation of what happened in each of those incidents.
Yeah, let's see. Let me share my screen really quick. All right, so here's the leading edge narrative that we just went over. So like Christina was saying, the FACE program also puts out these slideshows that has more pictures. So it basically has the same information that we went over on that one pager. But as you scroll down, there are more pictures. And so this photo right here, it says that it shows the lifeline with grab rope stretched, show the length from where the worker fell, which is X, near the plywood. So that, and here's another wider view of the building interior where the worker landed after falling. And then this looks like outside of the building. So it says fall protection anchor, shock absorbing lanyard, and lifeline near roof deck leading edge where the worker fell. And so that looks like that's it for that one. Was there anything else you wanted to point out, Christina?
No, thanks.
Okay. Yep.
Also, it looks like Al has his hand raised. Al, what do you have for us, bud?
Good morning, y'all. I was just, in the mode of best practices and passing on information as well. One of the things over the years that I've noticed is you go on to job sites, especially in the capacity of a general contractor and a general contractor safety professional, like I've been doing for the last 2 years here, with Dahlgren. We have an orientation and we go over our pre-task planning, our fall protection plan, and our hot work permits right in the orientation. And one of the most important things that I've figured out to ask these guys a lot of times, two important things on their fall protection plan, because our fall protection plan lines out the hazards, the components you're going to use in a system, how you're going to use that system, falling object protection, and also the fall rescue plan that somebody else had mentioned. Right. Two questions I asked. The first one is with a shock absorbing lanyard. I ask everybody in the orientation, can anybody tell me at what height you need to be at for a 6-foot shock absorbing lanyard to be effective just from a regular anchor point? And it's surprising how many people do not know the answer. They'll say 8 feet, 10 feet. And then I go out to the field and I see guys about 11, 12 feet with a shock absorbing lanyard on, expecting it to do its job. The other thing I asked too is when we're talking about fall rescue plans, I asked the question about how much time you have to get somebody down from once they've fallen and they're hanging in their harness. 10 minutes, 30 minutes. So the purpose of that is what I'm trying to do is I'm trying to get a feel for the training of the companies that are subcontracting under us and also our own training. But those are just two important questions to ask. It's really important to go out and ask those questions because there's a lot of people that are highly trained professionals out wearing these harnesses that have no idea what the limitations of them are. That's about all I had for today. I just wanted some best practice 2 cents.
Thanks, Al. And yeah, and one thing is, we could never, think that everyone knows everything about fall protection, and there's people that use it all day, every day, and still, don't know, exactly all about it. So it's really important that we treat everyone that comes on site like they've never used it before, because we're still seeing a ton of falls.
Thank you. Any other questions for Cassidy? Very good points, Al, to bring up. Thank you for that.
Hey, Rhett,
I also, yes, sir.
before we continue on, I would like to acknowledge that the Godfather, Rick Gleason, who has retired, but wait, has he really? Is going to be teaching 1 day a week at the UW's OSHA school. And I'd just like to have him comment on, for those of you who like to be trained by Rick, and don't we all, comment on the classes he intends to teach that 1 day a week.
Hey, thanks, Brian. Hey, so I just worked a deal, even though I retired from the UW. I'm going to come back to the UW OSHA Region 10 Training Center 4 days a month, or averaging 1 day a week. So if you come back for the OSHA 502 Construction Trainer Refresher, which is about 2.5 days, I may be the one teaching that, or record keeping, which is about half a day, or safety management, which is a day, or accident investigation. So I may still see you. So I haven't left everywhere, and I will continue every second Wednesday to be here for the Puget Sound Safety Summit. So Brian, thank you for coordinating that. And I love these online because you have to admit, you can't beat the commute. All right. Take care. Have a great day.
Thank you, Sir Gleason. We have another fill-in for you today, and I'm going to be providing a presentation that was handed to me by Brian Ducey. And Brian, this presentation, can you just give us a little info from this on who it came from and why we think that this is going to be beneficial for the group?
Yeah, sure. It came from one of my CPR trainers, who's also a sort of a first aid responder, as Tom Renner is, and does training all over the United States. And as part of his training, sort of introduced this PowerPoint regarding fentanyl. And it also, I don't have it in this one because I kind of edited it, but for first responders, how to react when you come across somebody who's in the throes of an overdose. But I just wanted to have Rhett sort of go over some of the pertinent information that is part of this PowerPoint. And it's very short, but I think it's so informative. And as I was talking to Rhett about this, the recent television movie about the Purdue OxyContin, the start of the opioid epidemic, was terribly interesting to me. And I think the major slide in this presentation also goes over what's happened since 1998, or when the opioid epidemic really began. So I'm going to turn it over to Rhett and go through this short slides presentation.
Excellent. Thank you, Brian. Yeah, we wanted to just share a little bit of information with you, as Brian said, on the history of fentanyl, and a little bit about the use in the workplace, and some of the different assimilation items that or methods that can be utilized for fentanyl use. And so this was actually first synthesized back in 1959, which is hard to believe. It's been around for a long time, but it was then approved for medical use in 1968. And there was a substantial lull, and now we've seen this ramp up. And of course, it's 2017. Fentanyl was the most widely used synthetic opioid in medicine. And while it is produced in a pharmaceutical grade as well, the majority of this is being produced out of country and being shipped in. It's being, I guess, for lack of better terms, injected or cut and mixed with other drugs. And some folks don't know that. And it's because it's such a low dose that can be fatal to someone. And there's just so many dangers with this particular drug. And in fact, it is 100 times more potent than morphine. And it is the most common drug involved in overdose deaths here in the United States currently. Very dangerous things. And as Cassidy mentioned earlier, there's a couple drug overdoses, and we didn't get into the specifics about this, but it may very well have been fentanyl in these cases. Now, the opioid crisis, here's the deal. Drug use in the workplace, it can really be obvious, and we're not going to go into great detail about this. We just wanted to scratch the surface for you guys. But it's obvious or subtle, and different drugs present in different ways. And employees under the influence of fentanyl might seem completely normal and functioning well. But then there can be noticeable mood or energy swings. And so when people are acting out of sorts, it may be something that we need to explore in depth. And of course, many of your organizations out there do go through supervisor drug awareness training, so we know what to do and how to respond, how to approach individuals, and communicate internally within the organization. But an employee under the influence of fentanyl can exhibit extreme happiness, then drowsiness, nausea, confusion, sedation, of course, and then worst case scenario, problems breathing or becoming unconscious when we start to see those overdose scenarios occur. With that being said, Brian mentioned this particular slide, and I want you all to kind of take a look at this. And we were looking at it this morning and thought it was very fascinating. What you'll notice in order of top to bottom, cocaine, when we look at the dark green and you look down at the graph, has actually increased since the beginning of, 2012. It started to have an upswing, and it continues to be on an upswing. Also, and again, this is drug overdoses per 100,000 people, by the way, if you didn't see that. Heroin, we can see that heroin has leveled off a bit since about 2016. And of course, our statistics that we were given by Brian's contact are only to 2018. So it'd be fascinating to see where we're at in the past 5 years. But what stands out the most is the blue line, which is synthetic opioids, and that excludes methadone. And you'll also note that methadone carries a purple line, and we've seen a decrease in methadone, which is often used in treatment for folks that have had problems utilizing these drugs. And so we see the methadone has dropped, but we also see synthetic opioids, aka fentanyl, skyrocketing through the roof. It is just so cheap to make it, and it's the cartels and drug dealers are mixing this in just about everything, and that's why we continually see a significant increase in drug overdoses across the country and even beyond. So what do you need to know? Well, fentanyl, it can be present in a variety of forms. It's powder, tablets, capsules, solution, rocks. Inhalation of the airborne powder is most likely to lead to harmful effects, but is less likely to occur than skin contact, except with patches. And that's what we wanted to talk to you today about, is the actual fentanyl patches. And so incidental skin contact can occur during daily activities, but it's not expected to lead to harmful effects if the contaminated skin is promptly washed off, which is a very important piece before I jump into the next slide. Anytime we are assisting someone that may have had a drug overdose or cleaning up of drug residue, we definitely want to wear personal protective equipment, right? Our standard operating procedure should be followed to a T. We might even use third parties to assist in this, in the event that we do have cleanup. Slow breathing or no breathing and drowsiness or unresponsiveness is a specific sign consistent with fentanyl intoxication, and of course, unconsciousness being overdose. And so although the drug can be injected or taken orally, as I mentioned in the previous slide, a common method to take the drug now is transdermal patches. Yikes. This is Duragesic is the most recognized brand name for these fentanyl patches. And get this, folks, it can last up to 3 days before it must be changed. And so that provides 72 hours of a time release drug use of said fentanyl. These are very easy to conceal underneath the clothing, on the arms, the back, the chest, etc. Is where those are typically located. But coming into accidental contact with the sticky side of the patch can cause the drug to be released into the bloodstream. And so there are many folks out there who have little or no tolerance to narcotics, obviously immunocompromised, children, etc. This can be life-threatening for them. And so not only is it something we have to take a look at in the workplace, but also outside of the workplace as well. As you know, these patches can fall off or be removed and be discarded on the ground knowingly or unknowingly, and that poses a significant risk for everybody. And so you have to be aware of them and what they look like. So we have a picture of it for you here. This is an image of a shoulder placement of a transdermal fentanyl patch. They're usually clear. The provider of the patch will usually sign and date those patches. And so in the event that you do see any of these on the job site that look suspicious, certainly don't pick them up. Notify a supervisor, try to contain them, and then if we do have to remove them or pick them up that are on the ground, obviously follow proper procedure, nitrile or latex gloves. But if the patch appears damaged, follow your policy for removal and disposal. Also, you probably want to clean the patch location before proceeding as well. If that sticky or adhesive side has come in contact with ground or surface, that can still leave residual. And residual is enough when we're talking about fentanyl. It also important to not use alcohol-based hand sanitizers. These do not decontaminate and they don't remove opioids. And in fact, alcohol does allow for better dermal absorption through the skin. So not a good methodology for cleaning. But legal patches will be clear and signed with the date and initials of a medical person applying the patch. So if you find these patches and you do not see, and they are clear in nature, and just like we saw on the last slide, and there aren't any initials or dates on them, and we're locating them on the ground, and there might be various names, but I did give you the Duragesic is the main brand, but there are others as well. Obviously, we want to start paying conscious mind to that and see if we can further perform an investigation to determine if anyone needs assistance or if it has been medically prescribed, et cetera, et cetera. Folks, fentanyl is something that has just absolutely rocked our country and also around the globe, and it continues to be a serious, serious problem. And as you could see from the stats that I provided on the one of the earlier slides, it is literally skyrocketing, and it's a scary time, for a lot of reasons. So when exposure occurs, prevent further contamination, notify first responders. If you do have somebody on site that does have an overdose and you do suspect it to be fentanyl, that is something that we do want to convey to first responders so they are ready to rock and roll when they arrive. One important piece, too, is if you've assisted an individual or accidentally come in contact with this particular drug in any format, don't touch any of your mucous membranes, eyes, mouth, nose, skin, anything like that, or even after touching a contaminated surface. Remember, washing with water and soap is the most effective means to remove this. Also, washing your hands thoroughly after the incident and any other areas that may have been contaminated. Absolutely before eating, drinking, smoking, applying cosmetics, using the restroom, etc. These are all main or roots of exposure that we can have, and we want to eliminate that to the best of our ability. And if you suspect any of your clothing, shoes, and PPE may be contaminated, make sure we're disposing of this properly. We got to follow our organization's decontamination guidelines and proper disposal for contaminated material. So that really concludes the brief glimpse at the fentanyl slides. This is something that you can go ahead and ask questions. I can't be certain that I will be able to answer those questions for you, provided this was just given to me today. But any questions?
Brett, if you send it to me and people want copies, they can email me or you.
Okay. Yeah, great. Yeah, absolutely. Folks, a lot of information. And before the presentation today, I was just looking through online, and I mean, there is a plethora of information out there and tons of statistics. This might be something that you want to expand on and take it into your organization and at least let people be aware of this so we don't have, unnecessary exposure, and we do have proper identification and protocol in place when we do encounter these things. And this is a moving target, right? I mean, these drugs have been around for a long time, but this particular drug has really taken the spotlight, and in a very negative way. And we want everybody to be fully informed and fully aware and prevent any unnecessary exposure, and also understand how to properly respond using Narcan and those other items as well. Outside of work, inside of work, it doesn't matter, right? We got to look out for one another and keep things safe. Questions?
This is Steve Andrews, and I have a comment. And the
All right,
comment
Steve.
is our children in schools. One of the problems with kids when you hear about them overdosing in a school environment is they very well have just reached out and taken, for example, a friend of theirs says, "Oh, I see you have a headache or you're complaining. Here, take this." And they think they're taking just a real simple drug that might be a Tylenol or something. And that's why the schools have a very strong push that you're not allowed to give other people drugs in school, even if it is an aspirin. So just reminding kids, they don't know what they're actually going to be getting because they're very vulnerable. So as a dad and grandfather, trying to educate our children to not be taking things that they don't know what they're actually getting may be helpful.
Certainly. And with these new transdermal patches, and they've been around for a little bit, but with them, we also need to educate the youth, as Steve has mentioned. I think that many of us, growing up, probably were educated on different types of drugs that were popular at the time and to stay away. And obviously, when you see hypodermic needles, we don't touch them, and there's certain protocol and bloodborne pathogen transmission and sharps protection. But now we're morphing into a whole new arena when we have something that looks like a Band-Aid, and that can be easily picked up and assimilated by a young child, which could, and even adult for that matter, and could cause, detrimental or catastrophic impacts. So I see a hand that went up from Tom. Tom, how you doing today? Thanks for joining, bud.
Good, thanks, Red. Again, my name's Tom. I'm with Bailey Construction, and part of my everyday carry, my EDC, I do carry Narcan or naloxone. So my background, I come from EMS. I used to be a firefighter paramedic, and so I have a unique set of skills. And obviously, this isn't something that that I preach out there to everybody, but I've given Narcan a lot, which is a reversal agent for any kind of opioid, including fentanyl. You can get Narcan free from King County. There's a whole bunch of different resources to get it for free. If it's something that personally you wanted to do it, I encourage that. You know how to use it. It's intranasal, so you actually give it up their nose. And the other thing that I wanted to talk about is, so fentanyl, right? We have a reversal agent for that right now, and that is Narcan. There's a new drug out there with increasing drug overdoses. It's called, the street name is called Trank, and the actual drug name is xyloxine. So it's something else. It has similar effects, sadly, to fentanyl and opioids without any kind of broadly distributed reversal agent. So something else to consider. It's just part of that war on drugs and overdose pandemic, really. That's all I got. Back to you, Rhett.
Thank you. That's very important information coming from Tom, and you do have a heavy background in that, Tom. So thank you very much for that information. And folks, you can look at different local municipalities like King County and look that up to find if you can or where you can go pick that up if you do want to carry that in a specific location on your personal side of the life or work side of the life. So we all do have access to that, and like Tom said, it is free. So not a bad idea, because we don't know when it might be needed. Question. More hands. Tom, that looks like your hand there. We already got you, unless you have something else, bud. All right, folks. Well,
No,
if
sorry,
there's
I
no
gotta
other
put my hand down,
questions,
sorry.
that's okay. I figure your hand was going to start getting numb there for a minute. But folks, we appreciate you showing up into the Puget Sound Safety Summit Conference today. We have our next summit coming up on October 11th, 2023. So we're just a month away. For those of you who will be out at the Governor Safety Conference, hope to see you all out there. And we'll see you next month regardless. Please join us, and the subject matter will be posted here soon with an invite coming from Brian Ducey. If anybody has any questions or comments, please feel free to reach out to Brian or myself. And if you would like any copies of the presentations or information and material, we'd be happy to send that to you as well. Thank you, everybody, for joining today. It's good to see everybody's smiling faces, and wishing you all a early, happy fall.
Thank you, Rhett.
Thank you.
Thank you.
Great job, you guys.
Thanks, everybody.
So Rhett, send me your revised PowerPoint.
You got it. I will send it over to you. I threw in a little bit extra information.
No, you did. It looks great. It was great. You riffed well.
Perfecto. I will send that over to you, and let's you and me reconvene here maybe next week and start kicking some ideas around.
Roger that.
All right, my friend. I will talk to you very soon.
Okay. Thanks, Rhett.
Bye-bye.